What's going on, guys? If you've ever seen the show Blue Mountain State, you might know the term we're about to talk about. It is the C word, the dreaded concussion that can happen in sports and athletics. And we're specifically talking about soccer and soccer related injuries. And one of the big things we also try to look at for injuries itself is one, how do we prevent them? Concussions, unfortunately, for soccer, they're not wearing anything to really kind of mitigate the concussion risk. There are a lot of rules and protocols in place, though, to try to help the players out to keep from being injured. But let's say, for instance, what happens when someone actually does get a concussion or is ruled out with a concussion. So there are lots of different symptoms, and they can manifest very differently in people, and depends sometimes on the severity of the concussion, how many concussions they've had, and the injury history just kind of in general itself. But a lot of times this looks very similar to patients who have a lot of issues with headaches. They don't like bright lights. They don't like loud sounds. They don't like trying to concentrate. They more likely don't like to be around people. And quite honestly, the initial first few days, the first couple weeks is a lot of that stuff. Is just trying to manage their symptoms and keep everything calmed down. On the other side of that too, if you're on a team, one of the great things about the team approach is you can get some input from nutritionists. There's some special nutrition stuff that is highly recommended for people who have concussions or dealing with concussions. There are some different medical practices out there too that will help deal with that specifically. And then if there's any balance or coordination issues, there's a lot of stuff on the rehab side that can be done around that as well to help with those players and with those symptoms. On the chiropractic side, we'll see a lot of times we'll very gently start to get in there and work on the musculature around the head, the neck, sometimes even the jaw and the upper back, and really start to try to get some stuff calmed down. We take a less is more approach, especially when we first start working with people with concussions, because they're still in kind of a teeter-tottering kind of state. Sometimes you can kind of push them over a little too much. So that's why it's very important to basically judge tolerance and start off very slowly when we're treating those in the office. But eventually we will get into some more of the chiropractic adjustment stuff to, getting the upper back to get a little bit more loose, help the joints of the neck move a little bit better, and just also continue to help with the muscles and any of the symptoms coming from headaches and that kind of stuff as well. And that can include muscle release techniques, that can include some dry needling, that can include just some gentle mobilizations, at-home stretches and stuff along those lines. And then one of the big things is once the body starts to heal, recover, is getting you back into your activity itself. And that a lot of times, if you're on a team, is kind of overseen by the athletic trainer. They do a fantastic job and have a ton of training in how to get their players back and onto the field. Can also be overseen by the physical therapist or the medical staff who are involved as well. And if not, if you're still having some issues, it's always a great idea to err on the side of caution and go get that checked out, or go discuss that with someone who has a few more ideas of how to help you out and get you back to playing at full speed again. So if you guys have any comments or any questions, feel free to drop those below. If you're in the Kansas City area, we would love to help you out and help get things moving and feeling better for you. And feel free to reach out.